Coronavirus numbers in Kenya are on the rise. The country now has a positivity rate of 16%, up from 4% in September. Hospitals have been overwhelmed by the surge of COVID-19 patients. ICU wards are filling up and many patients are reporting being turned away from medical centers. So when the numbers are overwhelming as they appear to be in Kenya, how do hospitals and health facilities determine who gets medical care first? When the pandemic was surging in Asian and European countries, The Lancet, a peer-reviewed medical journal, laid out several approaches on how medical workers can translate ethical values in the coronavirus experience. The first approach you might encounter at a hospital near you is a prioritarian approach, which, as the name suggests, prioritizes the sickest patient first. Take, for example, 3 patients arrive at a hospital at the same time. One has a broken arm, another has suffered a heart attack, and the third one has a persistent cough but is able to breathe without support. With the prioritarian approach in play, the patient with a heart attack would get first priority in receiving medical care over the other 2 patients due to the severity of their conditions. This approach assumes that resource constraints are temporary and that additional resources will soon become available to treat the other 2 patients. But during a prolonged scarcity of health workers as witnessed with the COVID-19 pandemic, this approach fails to consider this trade-off, that treating one critically ill patient for a long period of time will most likely require more resources and more personnel, while these same resources could treat several other patients who are not as critical. The second approach, the egalitarian approach, is also known as the equal chance approach. It suggests giving equal opportunity to each patient. Medical staff are also human beings and may have personal bias on the process of medical care. What this system aims to eliminate is this bias and recommends choosing patients randomly, just like in a lottery, giving an equal chance to access medical resources. For example, if 5 patients arrive at the hospital, the triage officer would choose at random either one of the 5 patients, and as a result, patients get an equal chance at accessing treatment but not necessarily an equal allocation of resources. Now let's assume that a very sick patient was to be selected first. This patient could use up a lot of resources, creating an even greater scarcity for other patients selected later. The third scenario is called the utilitarian approach, or the maximizing treatment approach. This approach looks at allocating resources with the overall goal being returning the greatest overall benefit to the population. Now, the first example in this approach would look at individuals with a longer life expectancy. For instance, if 3 patients walked into a hospital, one aged 19, another 35, and the third 65, the hospital would give priority to the younger patient. So if all 3 patients need a ventilator, then the youngest patient, who still has more years to live, would be treated first. The aim is to return the greatest overall benefit to the society. Another way this approach would come into play is when the hospital decides to treat patients who are not as sick first, since they are more likely to use less resources and would recover quicker than those who have severe medical conditions. But the primary consideration to most protocols worldwide is a combination of physiological factors such as the long-term and short-term survival. For example, if a health worker was to fall sick, a hospital might give priority to treating the health worker in assumption that the health worker would be able to return to work and aid in healthcare delivery. If a social worker like a government leader, heads of families, or even caregivers would fall sick, they would also get priority care because of their crucial role in the society. Finally, these protocols look at the life cycle of patients by prioritizing the early stages of life rather than those that are of old age. But regardless of the priority given, clear guidelines should be put in place to manage the peak of infections in any country.